Okay, so we're going to start the endocrine and hematological emergencies, okay? And like I said, we're going to go through a little bit rapidly because, again, most of the stuff that you already know, I want to focus on the stuff that you don't remember, okay? And then focus on what you're going to see on the psychomotor evaluation and in the cognitive. I want to do both, okay? Does that make sense? All right, so here we go. All right, so the endocrine system. What does the endocrine system consist of? What does the endocrine system do for the body? What is the endocrine? What is it? What is it? No, say it out loud. I just didn't hear you.
No, it gives us function.
Okay, it gives us function. How? Laura, what you got? What is the endocrine system? When I say the endocrine system, what does that consist of? Mackenzie, help us out.
The hormonal system.
Hormones, right? Hormones. That is the endocrine system in a nutshell, right? The endocrine system, it literally stimulates everything that goes on in the body. Everything hormonal, okay? Hormones are just signals that tells the body to do things, all right? That is the endocrine system in a nutshell, okay? So, when we have an issue with the endocrine system, it can affect a multitude of things in the body, okay? For hematological, what's hemato? What does hemato mean? HEMAT/O. We'll do a little medical terminology. I love medical terminology, so HEMAT/O. What is that? Wrong answers are just fine. What do you think? What's hematology? Blood. Good. Exactly. Blood. That's it. Hemato is blood. Okay? So hematologic emergencies are emergencies that are related to what, Miss Laura?
That are related to what?
Yes, that's the question. What are they related to? Hematological emergencies. It's related to what? What did we just say? Blood, right? Good. Blood, right? So those are actually difficult to assess and treat. How many times have we ever drawn blood in the field? How many times have you ever drawn blood on an ambulance? None. How many times have you ever drawn blood? Never, right? So these are going to be hard to assess because we can't test the very thing that they're having an emergency for, right? We have to know a little bit of the signs and symptoms of what they may possibly be going through. A differential diagnosis is, right? So let's go through these real quick, okay? So, endocrine system. The endocrine system is just like your parents, right? They want constant communication with you no matter what. You have Life 360? Yep. Do you have Life 360?
No.
You should. Shame on you, right? My kids have Life 360. You better believe I'm going to know where they're going. I don't care if they're 3 or 23, okay? My oldest son, he's going to be 25 this year. He has Life 360. I know where he's at all the time. And all right? I'm just letting you know, right? Because I want constant communication. And I can go into the rationale as to why later, right? But for now, right? The endocrine system consists of a bunch of glands in the body. Okay, it all starts in the brain. Okay, and works all the way down through the body and releases these chemicals, right? Called hormones. We have tons of different types of hormones. Okay, all right. So moving on. One of the big things that we need to be focused on is, again, the brain is very stingy, right? The brain needs both sugar and oxygen. How many people have ever gone on a keto diet? Low carbs. Or cut out carbs completely?
Oh, you boss.
No, I've never done it. But my mom did. She lost a ton of weight. Did great. Damaged her kidneys permanently.
Yep.
Because Well, one, right? One. Carbohydrates are needed for the body. We're not going to go into all of that, but carbohydrates broken down into sugar. Brain needs sugar. If the brain don't get sugar, it gets angry. It gets what we call brain fog, right? That's why glucose is very important, okay? Oxygen is very important as well, but we talked about that earlier, okay? Glucose. So, the pancreas in the body, inside the body, stores and releases insulin, okay? What happens if somebody doesn't have that insulin? What happens, Mackenzie? Go ahead.
The body can't bring the sugar into
The body can't break down, right, glucose into storable sugar, right? It needs insulin to do that. So when somebody doesn't produce enough insulin, right? They don't produce enough insulin, or they produce no insulin, then they have this disease called what, Laura? Huh?
if it can't break down sugar.
Yep. What disease do they have? I'm going to give you a hint. It's right in front of you. Not me.
Wait, I was gonna say not.
What is it? Diabetes. Yes. Very good.
Living with us.
Right? Diabetes. Okay? Now, there are now there are 5 types of diabetes.
Huh?
Now there's 5 types of diabetes. They're getting, we'll go into the studies later on, but there are 2 major forms of diabetes. You either need insulin or you don't, right? For, what is type 1? What is it?
You don't.
You don't need it?
Because your body's
That's the juvenile.
What's that?
That's the juvenile.
What'd you say? I can't.
Juvenile.
Oh, that's juvenile, right? Juvenile diabetes. Type 1. What's that type 1? What is type 1? Somebody tell me. Read it off the slide real quick for me. What is type 1?
Autoimmune disorders where the immune system produces antibodies against pancreatic beta cells.
Okay. Insulin cannot be produced or released. Okay? Without glucose, or without insulin, glucose cannot go into the cell or be stored at all and cannot give any energy whatsoever. Okay? These are the ones that have to have insulin. They have to give themselves insulin and a lot of other different kinds of drugs, right? They're the ones that have the little monitors, usually, I hope. They're continuously monitoring their glucose levels and paying very close attention to their A1C, right? A1C less than 6 is very, very good. That's the goal, right, Miss Dee?
I think they're even bringing it down further now.
Are they?
But yeah, but
Okay.
but less than 6 is great.
Yeah. How do we test glucose?
What?
Okay, what do we use? What device do we use to test blood glucose? A glucometer, right? A glucometer measures blood glucose in millimeters per,
Deciliter.
what is it?
Millimeters
Per deciliter.
Oh yeah, this is it, right?
Deciliter, right? MM/DL. Okay? All right. So, some symptoms of type 1. Polyuria. What's polyuria? Jacob, what's polyuria? Yeah, polyuria is excessive urination. What's polydipsia?
Excessive drinking.
Excessive drinking or excessive thirst. Okay? What's polyphagia? What's polyphagia? Nom 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 nom.
Oh, eating.
Excessive hunger. right? Polyphagia, weight loss, and fatigue. Okay, very tired because where do we get our energy? From sugar, right? We get our energy from sugar. Good. All right. So, normal blood glucose. Write this down. Normal blood glucose is between 80 to 120 milligrams per deciliter. Milligrams per deciliter. Okay? 180 to 120. All right? Once that sugar starts getting excessive, a lot of bad things start to happen, right? First, it starts in the kidneys. Even whenever the blood sugar gets too low, it starts in the kidneys. The kidneys are really hurt. All right, everybody get to 80 to 120? All right, here we go. Okay? So, if energy is not produced, right? If energy is not available, then the body starts using fat. Now, for some of us, like me, my body could use, a little fat to go away, right? There's a problem with the body using too much fat for energy. What it does is it introduces what we call ketones into the body. Ketones are not good, okay? That's the reason why it's always tested in your urine, because it's excreted through the kidneys. Ketones actually damages the kidneys, all right? And it's excreted through the urine, and ketones are not good for the body, all right? And then acidosis develops, and we'll talk about that whenever we get to acid-base balance, okay? Now, some things that you can expect: abdominal pain, body aches, nausea, vomiting, and an altered mental status. We all are good on that, right? Some pretty simple. Okay, so what's DKA? Diabetic ketoacidosis. When does that happen? What is it?
Too much ketones
Too much ketones in
in the blood.
the body, right? And how do we get too many ketones in the body, Miss Laura? What did we just talk about? How do we get too many ketones in the body? How does ketones get into the body? We talked about it just a while ago. When the body doesn't have enough sugar, what happens? It starts to use what? Yeah, my fat, right? My body could stand to use a little bit of fat, right? But what's the problem when it breaks down, when it only uses fat for energy? It produces what? What is it? Say it out loud. It doesn't produce insulin, it produces what we were just talking about. What causes diabetic ketoacidosis? Too much, what? Starts with a K? Ketones, okay? Ketones, it produces too much ketones. So when fat is broken down, it actually creates ketones. When that does that, it causes the body to go into acidosis, okay? That's why if it's caused by diabetes, then it's called what's called diabetic ketoacidosis, okay? Diabetic, meaning that's the disease that caused it. Keto is the reason that they're going into acidosis, right? Acidosis. That means the body is too acidic, all right? So, let's move on, okay? All right. Type 2. Type 2 is usually developed in the later stages in life. What I mean by that is your older childhood, younger adult life. Type 2, okay? This is where the body was producing it, but is no longer producing it. Usually you get man, I lost my train of thought. Usually you get, Usually it's diagnosed after like an exam, right? And then once you get this, you will need insulin and oral medications, okay? Things like that. You'll actually start getting recurrent infections, changes in vision, things like that. All right? So, some key signs. Of course, hyperglycemia, right? Severe dehydration, thirst, dark urine, visual sensory, right? And then sometimes when you get really, really high levels of sugar, you start seizing because the brain, again, the brain is very, very sensitive, right? The brain is very sensitive. We talked about polyuria, right? The urine becomes dark and concentrated because of ketones, all right? And then the patient may become unconscious or go into seizures because of dehydration, okay? All right, so insulin. Well, let's talk about hypoglycemia. Okay, so for hypoglycemia, okay, this is where there's not enough sugar in the body, right? For hypoglycemia, right? Some signs and symptoms: normal to shallow respirations, pale, moist skin with diaphoresis, sweating, right? Sweating, dizziness, headache, rapid pulse, normal to low blood pressure. Okay? I need to get my clicker. That's what I need. So, you'll also have an altered mental status, anxious or combative because you don't know what's going on, right? I'm very confused. I don't know what's going on. All I know is that I got a huge brain fog and there's a bunch of stuff going on around me, right? All right. Weakness on one side, rapid changes. So, the biggest thing I want you to do, pick up your pencil or paper, or pick up your pencil or pen, and I want you to draw this chart on your paper. Draw this chart. Can you see it? Okay, so I will help you. Okay, no problem. So on this chart, you have the levels of blood glucose. So draw this little box here. This is your blood glucose level. I want you to write the numbers 50 at the bottom. I want you to write 80 right above it. Then I want you to write 120. And then I want a huge space here, and I want you to write 400. Okay? Again, those numbers are in sequential order from bottom to top. 50, 80, 120, 400. Now, it's also good to write the measurements. So it would be milligrams per deciliter, mg/D capital L. Okay, that's all those numbers. Once you're done with that, I want you to draw an arrow going to each of those numbers, and I want you to write the following. I will stand by and wait for you guys to catch up, okay? If you don't get anything from me today, this is what I want you guys to focus on. This is going to be your bread and butter of this, okay? Are we ready? Ready? Okay. For 50, the arrow going to 50, I want you to write hypoglycemic crisis. What does that mean? Good or bad first? What's a crisis? That's no good, right? So anybody with a blood sugar of 50 or below is in a hypoglycemic crisis. Okay? They are not just hypoglycemic, they're in a crisis. A crisis is they're circling the drain. Okay? Now to your 80 milligrams per deciliter. Okay? Underneath it, I want you to write hypoglycemic. It should be in between the two arrows between 50 and 80. This is your hypoglycemic area. Between 50 to 80 is your hypoglycemic area. Okay? hypoglycemic. Hypoglycemic. All right. In between your 80 and 120, what do you think's going to go there?
Good.
That's your normal blood glucose level, BGL. Good. So between 80 and 120 is normal. Okay? Now you got a huge jump, that huge space from 120 to 400 is considered hyperglycemic. Hyperglycemic. Okay? Anything above that is considered severe hyperglycemic. Okay? Most likely DKA. Write that at the top. What's DKA? What does DKA stand for? Diabetic ketoacidosis, right? Diabetic ketoacidosis, right? Because it's not using that sugar in the blood, right? It's all staying in the blood. And since the body can't break down that glucose, all that sugar's running around the body with nowhere to go, while the body's starving for fuel, and so it starts eating fat. Okay? All right. How do you reverse hypoglycemia?
Glucose.
Glucose. Good. Oral glucose. That's what we use, right? Oral glucose. Okay, it's like feeding somebody icing. Oh man, I could just eat icing out of the tub. Oh, it's so good. I love it. Icing is so good. All right, anyways. Oral glucose, right? All right. We talked about that. Talked about that. We talked about that. Okay, now, I think we're good on diabetics. Any questions on that? I don't want to bore you guys to death. I'm almost on my mark to be done here, okay? Go ahead.
Are we gonna talk about the different ways to deliver glucose and also glucagon?
So, we're going to we'll talk. I'll talk to you about. I'll talk about that here in just a little bit. We'll get through this, and then we'll talk about glucagon here in just a minute, because glucagon is not. Yeah, glucagon is one of those things you have to give IM, right, in order for in order to do that. But real quick, I want to go over the hematologic, some things you got to look for. Okay. All right, some things that you got to talk about. I wish this projector was up a little bit. I keep walking in front of it. All right, sickle cell, hemophilia, thrombophilia, and anemia. Those are the ones that I want you to be familiar with, okay? What's sickle cell disease?
Where the blood cells are shaped, wasn't it like a crescent?
Yeah.
And
So what's shaped like a crescent? Which cells?
The red blood cells.
The red blood cells. If the red blood cells are altered, what does the red blood cells do in the body anyways? It's, okay. We got there's some clotting factor, but what specifically does the red blood cells, what are they responsible for?
Circulating blood.
Yes, with the blood.
Oxygen.
Right.
There you go, right? They carry oxygen. If they're sickled, then what can they not do? Absolutely, right? They're not able to bind with oxygen and carry it throughout the body. Okay? That's sickle cell. Okay? That's the reason why people with sickle cell anemia, right? They have issues with oxygen delivery. They get a low SpO2 when they do things like exercise, play sports, things like that. That's why it's very important for whoever, if somebody's got sickle cell, right, to let somebody know, right? What is sickle cell? What demographic is sickle cell prevalent in? Those of color, right? African Americans, things like that. Okay. All right. Hemophilia. What's hemophilia? Kenzie, go ahead.
The blood won't clot.
Yeah. So hemophilia is where if I come up and you literally bump into this, if I bump into this table and I scratch my skin, I'm going to sit here and I'm going to bleed and bleed and bleed, right? That's hemophilia. Okay? So for sickle cell, that's what they look like. Okay? What demographic does hemophilia A mostly present itself in? Males. Right? Males. Okay? This is a clotting disorder. All right? Any questions on that? We're good? Oh, let's go back. All right. Thrombophilia. Okay? Thrombophilia is where people are where they're able to do just the opposite, right? They're able to actually clot a lot faster. That seems like that would be a great thing. What's the issue with being able with thrombophilia? The problem is if they're able to really clot really well, that's really great if I bump myself on the table, right? But the problem is that it doesn't stop there. They can actually create clots inside a vessel. And why is it bad to have clots floating around the body?
That's how it works out.
Why would it be bad for clots to be floating around the body, Laura? You got these little bitty clots that are just just floating around the body. What do you think? What happens? What can happen? Absolutely. How does it affect it? You're absolutely right. You're on the right track. Absolutely, right? These little blood clots, they float around, right? The problem is if they're created in these huge veins, right? And then they float around to the veins in the lungs. How big are the veins in the lungs? Not very big, right? And then they get stuck. And then all of a sudden, what happens? What happens if you put a cork in a bottle? It stops flowing, right? There's nothing it can do, right? There's no blood flow getting to that area. So if there's no blood flow getting to that area, what can start to happen? What starts to happen to organs if they stop getting blood flow? They shut down, right? They shut down. They start dying. Okay? Good. And then you have, and again, thrombophilia can cause this right here. Deep vein thrombosis. Deep vein thrombosis, those little clots, right? That form after an injury or a surgery. Now, DVTs can also form if you don't. You know what can cause a deep vein thrombosis? Sitting down too much. Airplane rides, people who travel overseas a lot. Or females on what? On birth control. Absolutely. Females on birth control are prevalent for these as well.
And also it increases with nicotine use.
It does what?
Nicotine use with birth control can also increase that chance.
Yes, absolutely. Okay? So, this right here, yep. DVT, a lot of times, more prevalently, they usually appear in the lower limbs. Usually, again, not always, right? So, whenever you start hearing somebody complain of, my leg has really started aching in the past week, and it's really warm and it's painful to the touch, right? Like extremely painful, you can't touch it. Okay? The first thing I'm going to think of is this. Is it a DVT? Okay? The only way to treat that is through anticoagulation therapy. They have to go in and bust that clot. Okay? They have to go in and bust that clot. Okay? Usually, this takes a while, right? They go in, they give you a clot buster, and then they put you on blood thinners for a little while in order for that clot to finally dissolve and you're not able to produce another one. Okay? What can we do for DVTs in the field? Position of comfort transport? We can't give anticoagulation therapy? No? No clot busters?
No, not yet.
What is one thing that we could consider, maybe?
Aspirin?
Why aspirin?
Vasodilator. Or, no, the platelet aggregate. It's a platelet aggregate.
Is that it stops the aggregation of platelets, right? What is platelets responsible for?
Clotting.
Clotting, right? Good. All right. All right. So, real quick, let's recap. Okay. Recap. Tell me about what does the endocrine system do? What is it responsible for? How does it work? You okay? What is it? The hormones. Good. Great. All right. Good job. So, the endocrine system, it deals with all the hormones in the body. I'm running over. Okay? Hormones in the body, right? Let's talk about the first biggest issue that we usually see in the field. Diabetes. Okay? What does diabetes entail? What happens how do you become diabetic? Or why are you diagnosed with diabetes? What happens?
Insulin deficiency.
What is it?
Insulin deficiency, right?
Insulin deficiency, right? What organ produces insulin? Or I'm sorry, what organ releases insulin in the body? Yes, you do. We talked about it. Starts with a P. What releases insulin? What organ? All right, phone a friend. What do we got? Somebody tell me. The pancreas. Good. The pancreas. The pancreas is what releases insulin, right? What does insulin do for the body? What does insulin do?
It's body energy.
What?
It's body energy.
How? You're right. You're absolutely right, on the right path. How does it give the body energy? It does. It breaks down sugar. Good. Okay? So, if the body is not able to produce insulin or release insulin, right? One or the other. Okay? Then sugar is not broke down into the form that the body can use for energy. So it's just free roaming in the blood, right? And that's where how you get sugar in the urine, right? Now, the problem with that is the body starts using what for energy if it doesn't have sugar? What is it? Yes, fat, right? Good. And if if it starts breaking down fat, what's created? Ketones, right? Ketones good or bad? Right? It can cause diabetic ketoacidosis, right? Too many ketones causes the body to become more acidic, and that's bad juju, right? What do people usually have to inject themselves with, or oral medications? Insulin. That's it. Insulin pump or insulin. They give themselves insulin so that way it can break down sugar. Good. All right. So that's diabetes.
What's a popular just oral medication that they take?
Glucagon. Or glyburide. Glyburide, right? Okay. All right. Let's see. Sickle cell anemia. Tell me about it. What happens?
Sickle cell shaped blood.
Yep.
Carried.
And why is sickle shaped red blood cells not good? What can they not do if they're sickle shaped? What do red blood cells do in the body? What do they carry? What in your blood, you got red blood cells. What do they carry? What do red blood cells carry, deliver throughout the body? Oxygen. Good. So they can't carry that oxygen, right? And that's an issue, right? All right. And then we have hemophilia, which is what? They're not able to do what? For hemophilia. Yes, your blood won't clot, right? And then what about those that have what did we go over? Let's see. Hemophilia. Thrombophilia. Holy moly. Thrombophilia. What happens with thrombophilia? Yeah, they clot too much and they produce it, right? And then that rolls us into, what's the DVT?
Deep vein thrombosis.
Yes, those are bad juju, right? What can we do in the field for these hematologic emergencies?
Is that indicated? Could we use aspirin for that or not?
It is not. It is not part of the protocol,
Okay, so no.
right?
Transport in the position of comfort, and then
Yeah.
also be prepared to deliver oxygen.
Right. Be prepared to deliver oxygen. Call ALS because they're going to need something intravenously. All right, good. All right. I hit my 20-minute mark. I can't do more than 20 minutes. Is there any questions? Are we good? All right. What do you guys owe me?
Drugs.
And you owe me that mind map. All right. So go ahead and take a break.